On that note, can you tell me a little bit more about what health systems are doing with respect to remote care and virtual care programs? Because we see that more of them are getting interested in it now and becoming, or at least becoming open to it. Why do you think that is?
Yeah, I think the market is catching up with some of the innovation that happened when these codes first came out in 2015, and then in 2019, 2020, remote patient monitoring or monitoring vitals was now approved by Medicare as well. And health systems usually have a kind of wait and see approach to new programs, and at the time it was very novel, right? It was one of the first codes that you could bill without seeing the patient face to face in the office and actually physically in the office as well. And so there was a lot of hesitancy, I think, in the market, especially before COVID. And then we all and health systems were just ransacked with COVID and all the complications that came with that. But also then all innovation kind of got put on pause, right? The hospitals were really the backbone of the health system there for probably almost 3 to 4 years. And so we didn't see a lot of new initiatives start during that time. But I think what has happened is not only are patients more comfortable with virtual care and digital care and even telehealth and so are health systems, right? They had to implement it quickly and efficiently and effectively in order to treat their patients during the pandemic. So we're seeing now the dust settle from the pandemic, but also we have this residual effect where now health systems and patients want to jump into digital care or remote care and remote patient monitoring, chronic care management, and even some of the other services available like transitional care management if not all or most of those services can be done remotely now. And so with that, there's a lot of questions, and now there's finally a lot of jumping into these services through health systems.
Yeah, that's exciting that now health systems are looking at things more than telemedicine and remote care monitoring and care coordination.